Thank you very much, Mr. Chairman, and thank you to all of our witnesses today for your excellent testimony. I too have heard from families across my home state of Washington who are really struggling to afford health care, and I've been absolutely clear from the start, Democrats are at the table. We are eager to work with Republicans to bring costs down for health care for all. The bill that we're talking about today is an important step in the right direction. It is also proof that when Republicans and Democrats join at the table and put partisanship aside and put our families first, we can find common ground and help the people who are looking to us for relief on health care. People like Stacy, she's a woman from Seattle. She wrote to my office about how she got an unexpected ER bill for over $1,000 after she had a bike accident because while the hospital she visited was in network, one of the doctors who treated her was not. And Stacy also shared with me how her mother has struggled with high health care costs too, because after her mother was diagnosed with type 1 diabetes, she was forced to move in with Stacy to afford her insulin. So families like Stacy's, and there are so many of them, are really looking to us for help. So I'm really glad that our legislation works to address surprise billings, so patients like Stacy will no longer get caught off guard by exorbitant charges for out-of-network care through no fault of their own. And I especially want to thank Senators Hassan, Bennett, Carper, Cassidy, Young, and Murkowski for their work on this issue. This bill also works to open the doors for a cheaper generic insulin, which could bring down costs for patients like Stacy's mom. And it would make it harder for drug companies to game the system and put up roadblocks to competition from cheaper generic drugs. I want to thank Senators Kaine, Shaheen, Smith, Casey, Cassidy, Collins, Enzi, Roberts, and many others for working together on many of the ideas in this bill. And those are just a few of the many common steps we were able to come together on. Thanks to the work of Senator Peters and Duckworth and Roberts, this bill includes a strong response to the threat of vaccine hesitancy and supports efforts to counter misinformation and increase vaccination rates in communities that are at risk of outbreaks. It includes investments in public health data systems pushed for by Senators Kaine, King, and Isaacson to better protect families against public health threats, and would ensure that state, local, and tribal health departments have important guidance on obesity prevention efforts, thanks to Senator Jones and Scott. It also includes the proposals from Senator Schatz, Kaine, and Murkowski to help expand the ECHO telemedicine model, which we heard about in our hearings on the opioid crisis, so it can be used to bring care to even more people in more places and help address even more health care needs. It includes proposals to update electronic health records to make health data more accessible for providers and patients alike, and it would take a much-needed step to respond to our country's maternal mortality crisis, including supporting investments in care for pregnant women and providing implicit bias training to help address the fact that women of color in particular are dying at unacceptably high rates. Overall, this bill offers a lot of good bipartisan steps. So, Mr. Chairman, I hope we can continue to improve it in the coming days by continuing to work on proposals such as Senator Baldwin and Braun and Smith and Murkowski's important drug price transparency bill. But I do want to just say, to be clear, if we're really going to bring down costs across the board and help families who are struggling, this is no place to stop on this bill. Far from it, because even as this bill offers families important relief on many issues, the administration's policies are undermining health care for tens of millions of people across the country. They have rejected Democrats' efforts to defend for protections for people with pre-existing conditions, coverage for people nationwide, from a partisan lawsuit that is now moving through our courts. President Trump has allowed insurance companies to go back to selling junk plans that leave people with pre-existing conditions vulnerable and refused to take significant action to curb drug prices despite campaign promises. And he has slashed investments in helping people navigate the healthcare system and get the plans that are right for them. To put a finer point on it, when your car's totaled, you can't fix the windshield and expect to start driving. So we have a lot of work ahead to do with us. And I am really glad that we are here together on this legislation, and I'm going to keep making it clear it needs to be a first step, not a last one. Democrats understand that. I know families do as well. We have a lot of critical work ahead of us beyond this. So thank you very much, Mr. Chairman.